So we are in the middle of a global health crisis. I love that we actually wrote this before this slide before the pandemic, and then the pandemic came around, and still in the global health crisis, we don't really talk about the pandemic, which I find very interesting, because this global health crisis has been around a lot longer than COVID-19. So the global health crisis is that there are 80% of adults 65 plus that have at least one chronic condition, and 68% have two or more chronic conditions. And that's 65 plus. But the truth is, we are seeing the beginnings of these really much earlier in people's life. And we talk quite a lot in our work about precursors, that we start to see red flags and precursors in people's early life. Now, these are the big 10 chronic conditions for adults of 65 plus. And so hypertension, high blood pressure, and what's interesting is you'll start to look at how many of these are medicated. High cholesterol, 47%, arthritis, 31%, heart disease, ischemic heart disease, 29%, diabetes, of course. I'm surprised it's not more than that, but we have pre-diabetes as well. Chronic kidney disease, heart failure, depression, Alzheimer's disease and dementia. We've got some juicy information for you later on that one. And COPD. So these are the big 10 issues that are affecting adults of 65 plus. So if we have this global health crisis, and quite a lot of this is we are able to apply medication to, but quite a lot of it we can't. And so something like ischemic heart disease, there is medication, you'll be put on medication, but a heart disease isn't necessarily a medicatable, they'll medicate the symptoms, not necessarily the root cause. But that's what you start to find with a lot of the medications that for these chronic conditions, is we're medicating the symptom and not the cause. And so then what happens is people end up with the side effects of the medication, they end up with further conditions, because the root cause, if you're then suppressing the root cause, it's just going to start creating other conditions. And it becomes very, very common that people have a whole litany of these chronic conditions by the time they are heading into more mature years. And we have normalized ill health as part of aging. And in quite a lot of the indigenous tribes where they're living on a diet that is more species appropriate and living a more species appropriate lifestyle, they're not seeing these common signs of, we're getting older. They're not seeing those becoming endemic within their tribes. So we have to start looking at, well, what is it that's causing all of these problems in our population? And like I said, this is talking about it in 65 plus. But we are seeing the precursors, and by precursors, I'm talking about things like migraines, IBS, acne, joint pain, brain fog, terrible menopause, PCOS, endometriosis, or any symptoms that people are experiencing where there is any kind of chronic response, inflammatory response in the body, are precursors to these major chronic conditions. And so we have to start asking why. I mean, I never saw children in my clinic when I started. It was rare. I think I had like a couple. I'm seeing young children now with chronic issues. So what we have to address is that there is, climate change is a big problem, because it is changing our, like how the seasons affect us, so our circadian rhythms, but equally it's also causing a problem with our crops. And we have huge amounts of pollution, pesticides, the food chain depletion. Our NHS is struggling. Medication usage, such as the Pillars and HRT, is a big issue. Chronic health conditions, including the ones that we've got over here, but also obesity, of any inflammatory condition, hormone imbalances, and cancer. We have now normalized as 1 in 2. Now, I remember growing up and cancer was probably about 1 in 6, maybe it was starting to tip into 1 in 5, and it was terrifying, but it was far away. How have we now normalized it's 1 in 2? That is absolutely terrifying. And I truly believe that holistic practitioners are no longer a nice to have. We are essential. but we're still considered the last resort for many, and it's because they don't get any answers from the doctors, or the doctors just want to go fully down the big medication and surgery route, and people are looking for other options.